Good evening, everyone. Thank you so much for joining us today. Buenas tardes a todos. Muchas gracias por asistir a nuestra sesión. Tonight's Parent University session topic is homelessness and where to go for help. Gracias por asistir a nuestra Universidad para Padres. La sesión de esta noche es cómo obtener ayuda si no tiene vivienda. Before I go on, I want to just remind our families who speak Spanish that we do have a Spanish interpreter, and I'm going to say this in Spanish. Para todos los padres que están en la llamada ahora mismo, por favor, si pueden mirar hacia abajo de su pantalla y mirar que pueden encontrar un globo. Ese globo lo pueden presionar y elegir el idioma, que en este caso, el único idioma que estamos usando esta noche es el español. Cuando presionan el idioma en español, de una vez van a poder escuchar el intérprete. En este momento el intérprete no está hablando porque yo estoy hablando. Entonces, de una vez que yo termine en español, toda la información que yo voy a proveer va a ser en inglés. Entonces, van a seguir escuchando en ese canal con el intérprete que le va a decir toda la información en español. Gracias. So as we go on, what I wanted to do was actually go through some norms, but I do want to make sure that you all know that we do have a special guest this evening, and she is going to co-present with myself and Natalie Perez from our FACE office. Our special guest is Teresa McDevitt. She is from Crossroads, Rhode Island. And in a few minutes, we will introduce ourselves. But before we introduce ourselves, I want to go through some norms. So please continue to look at your screen. Oops. Okay, and so these are just some basic norms to help you understand what the flow of the presentation today will be. So the presentation will be a webinar format. You will not be able to see each other as participants or attendees, but only the panelists and the facilitator. The panelists will try to answer as many questions as possible. The panelists for this evening will be all three of us who are on the screen right now, but we are also hosting the webinar, and we'll be able to answer any questions. All the microphones of all attendees will be muted unless the attendees raise their hand to ask a question live. And I will talk about that in a little bit further. This session will be recorded and posted in the district website. I also added the actual website here on the screen. And here, I just wanted to highlight the icons at the very bottom of your screen. You can see the icon Q&A. This Q&A, what you will do is that during the presentation, you can actually write in your question or comment that you would like to share. And one of us, in this case, either Teresa, Natalie, or myself, will be able to answer the question. We may ask the question out loud so that folks know exactly what question is being answered, and then provide the answer as well. If you wish to write the question in Spanish, you can do that. And we'll be able to also respond in Spanish. At the very bottom, you'll see another icon, and that is the hand, the raise hand. And so if you prefer to ask your question out loud, then what you will do is press this icon, the raise hand. Once you press this icon, your video will appear on the screen, and we will ask you to unmute yourself. And therefore, you will be able to ask your question live and not have to write your question. If you ask your question in Spanish, we will be able to translate your question out loud in Spanish. And then one of us will be able to, will translate from Spanish to English. And then, one of us will be able to respond to you. And again, in Spanish. We do have our Spanish interpreter who will remain in the interpretation channel. So that way, at least, the interpreter will continue to assist with interpretation. And again, you will also see one more feature at the very bottom of your screen, and that is the chat feature. The chat feature, you will not be able to enter any information. So again, remember, you're going to use the other two, which is the raise hand and also the Q&A. The chat feature, we will direct you to that chat feature if we insert a link with information, and we will be doing that at the very end of the presentation to ask you for your feedback regarding the presentation this evening. And so with, and then also, again, we're going to try to answer as many questions as we can throughout the presentation. So we will definitely be monitoring any questions that come up and if anyone raises their hand. Okay. And so I did want to also remind everyone that at the end of the session, we will have some giveaways. And so we will ask our guest, Teresa, if she can answer any additional questions. If there are no more questions, Teresa will exit our session and we will then proceed with the giveaways. Okay. And I do want to announce what are those giveaways. We have a $25 gift card to Nice Slice. Also, 5 free admission tickets to the Roger Williams Park Zoo. And we also have a ceramic vase, a beautiful vase. And I will show you that a little bit later. That is valued at $31. And so we want to be able to, again, make sure that we give those away this evening. So please do not leave at the very end. We need your feedback. We want to learn what you were able to learn for tonight and what else you might want to learn more about in future sessions. Okay, so with that, we'll start with our session this evening. Again, the title is Homelessness and Where to Go for Help. And here, I'll introduce myself. So again, my name is Janet Pichardo. I'm the Director of Family and Community Engagement here at the Providence School Department. I've been here for over 15 years. And another role that I'm responsible for is that I'm also the homeless liaison for the district. And so this particular session will concentrate mostly on that work that I assist with. And so we'll talk about, how we support our families in the district, some of the barriers that many times our families face that are, facing house insecurity, home insecurities, and also review and improve any systems that we have in place. And so this is one of the ways that we're trying to improve our way of supporting our families, which is building awareness and building the skills and knowledge of our families. And so I know that our attendees this evening may be parents, maybe grandparents, siblings, friends, uncles. The point is that those who have joined us this evening is because this information is important, but also because you're looking to find out how you can share that information with others. So with that, Natalie, if you can introduce yourself.
So good evening, everyone. My name is Natalie Perez, and I'm a parent engagement specialist at the Family and Community Engagement Office. Specifically, I help to assist Janet, the homeless liaison, with identifying and referring parents to internal and external resources that we'll get into later. And then also as a parent engagement specialist and faith team member, we help with supporting all families in the district with guidance, advocacy, and resolving concerns. We also do community outreach on behalf of FACE, such as the Parent University and the PAC. And we also help out with things like facilitating and hosting these sessions. Teresa, if you can introduce yourself as well.
Sure thing. Good evening, everyone, and thank you for having me here tonight. Hoping we can answer a lot of questions that you may have concerning housing and homelessness. My role here at Crossroads is the director of the Coordinated Entry System, which is the system that the state of Rhode Island uses for anyone who is in search or in need of homelessness assistance or housing assistance. My role also includes the front desk at Crossroads. So basically I oversee everyone that comes in the front door of the system. We like to get our roles out into the community in that we want to help people as quickly as possible. If for some reason someone is facing homelessness or housing instability, we want to make sure that they feel comfortable enough to get in touch with us as quickly as possible, so that we can, help from where you are at that moment, rather than waiting for someone to actually lose housing. So that it's pertinent that you come in, or anyone, if you know anyone that's having issues, that you get in touch with us as quickly as possible so we can help with assistance. One of the other things, I'm just seeing the screen there, it's no longer Housing Help Rhode Island, but we do have 2 team members that work with Rent Relief Rhode Island. So if anyone has any questions regarding rent relief, I can certainly answer those questions as well.
Very good. Thank you so much. Okay, so let's move on here. And so for the rest of the session, these are the highlights and what we will be concentrating on. And so we want you to leave this session understanding what is the definition of homelessness according to the U.S. Department of Housing and Urban Development, recognizing the common signs of homelessness and the connection between home and school, but also understanding the system of supports within Crossroads and the coordinated entry system, and understanding the McKinney-Vento Homeless Assistance Act and our role as a school department to support our students facing homelessness. And finally, again, understanding how the PPSD community, our school district and staff can help identify and support families experiencing homelessness at this time. And so overall, the purpose of this session is to build awareness, increase awareness and identification of homelessness in our community. And so Teresa will get us started with regard to the definition of homelessness under HUD. Go ahead.
So one of the things we wanted to explain is that there are different categories of homelessness. Those categories pretty much let us know who is prioritized for services. Category 1 would be folks, individuals or families who lack a regular, fixed, adequate nighttime residence. So if you or someone you know is living in a car, is living on the street, is living in an apartment with no utilities, no hot water, anyone who would be living in a privately or a publicly run shelter is also considered literally homeless. We also have part of that definition is anyone who is coming in to the system from an institution, whether that is a hospital, whether it is the ACI. If you have resided in that facility for more than 90 days, I think it's 120 at the moment. And if you resided in a shelter prior to going in, or you were living on the street prior to going in, or maybe in your car or an RV, even when you come back out of those institutions, you are also counting as that category 1 literally homeless. We do want to make sure resources are I don't want to say they're lacking. We're doing everything that we can in order to get shelter and places for folks to stay. But that category 1, category literal homeless, that is where our attention is focused, getting folks off the street into someplace safe and warm and stable. The next definition would be category 2. And Natalie, can you move to the next slide, if you will?
Well,
Category 2 is for those individuals or families who are at imminent risk of losing their nighttime residence. So for the most part, it looks as though for housing, we look at those who will lose their place of residence within 14 days. So if you let's say today is December 1st. If for some reason you find out on the 17th of December that you are going to lose your housing on the 1st of January, we would qualify you as category 2. Also, if you don't have another place to go, I know right now we are in a situation where landlords are selling units. There are a lot of eviction issues going on out there. So if you have received an eviction notice or you've been notified that your landlord is going to be selling the house, that also would count you as category 2, imminent risk of homelessness. And then if the family lacks the resources or supports needed to obtain permanent housing, that would also count you as category 2. One of the most common category 2 situations that we find is that folks are couch surfing, where they stay in one place for a couple of days and then they move to another home. They may move to their car and, you know, they're just couch surfing, hopping around to different locations. So that also is category 2, imminent risk of homelessness. Category 3, if you would move on to the next slide, Natalie, has to do with homeless under other statutes. Typically, category 3 is not used very often. We are pretty much focused on unaccompanied youth, anybody who is under the age of 25 years old, or families with children and youth that do not meet any of the other categories but are homeless under other federal statutes. So we may have somebody who is living in a hotel. We may have a family who has not had a lease and they've had to move 2 or more times in the past 60 days. And then there are other situations that we can look at that would cause someone, a family, to remain unstable due to special needs or barriers within the system. So that will be category 3. And then the last category that is defined by Department of Housing and Urban Development is category 4. And that would cover anyone who is fleeing or attempting to flee domestic violence. You have no other residence to go to, and you would lack the supports and resources to obtain permanent housing otherwise. So those are the 4 categories that we look to when we are talking with families and individuals about their current situations. One of the things we like to do is try to rectify the situation and get folks back into stable housing by utilizing what the families and individuals' strengths are. Let's talk a little bit about what common signs of homelessness look like. There are some larger groups here. Every child, every person has a different reaction to homelessness. There's not just one standard reaction. We may have issues with educational continuity. We may look and see that some folks or some kids are not eating well and their health is declining. Maybe they're losing weight. Maybe they are angry. They are sad. They can be depressed. They can be overly excited by not having a stable place to stay. So we want to look at how the situation affects each person individually. Transportation and attendance problems. If you are having an issue living in your car, you may not be able to get to your child's school, right? Sometimes living in a car is not so easy. It's not as easy as just pulling over into a parking spot. There are a lot of places where folks are not allowed to park, and you may have to go further out in order to find a safe place to be overnight, but it may take you some time to get your child back to school. Attendance problems are very often seen in folks that are experiencing homelessness. Poor hygiene, lack of personal space after school. I don't know, how it is for each of you, but trying to get homework done in a crowded vehicle with brothers and sisters who are hungry or tired can be a very big challenge. So finding a personal space and places to be where you can be alone instead of being cramped into a single room with a large family. We want to look at social and behavioral concerns, right? We may have poor attention spans. Someone may experience a marked change in behavior. They could be difficulty socializing at recess. Sometimes it's hard to talk about the situation. And maybe if a child were to get asked a question in school about where they live or what their current address is, they may not have one. They may hesitate in responding. You may see developmental delays and school phobia, not wanting to go to school, being afraid. Sometimes folks are very afraid that if the system finds out that their child or they're experiencing housing instability or homelessness, there may be repercussions and getting other agencies involved, which is not the case where we are concerned. But nobody is going to take any children away from just experiencing homelessness. That is not a reason for anyone to take anyone away. Our focus is to make sure we get you back into stable housing. And then just, I think, some of the reactions and statements by parents and guardians and or students. As I said, they may not be sure about what answers they should be discussing with parents or teachers or principals. They may be hesitant, as I said before. They may not remember the last place that they lived. They may say questions or comments about moving around a lot. So these are just a lot of common signs. It's really just to make sure that you are aware that homelessness can affect students, adults, families, individuals in many different ways. Certainly not everyone is going to have one of these common signs. They may have multiple signs that are different. Brothers and sisters can react differently. Parents, mothers, fathers can react differently. So I just wanted you all to be aware that there are a lot of signs with regards to homelessness.
Teresa, we do have someone that has raised their hand.
Sure.
Okay. And it's Jason. Jason, if you can unmute yourself, please. Jason, please unmute yourself because we can't hear you. So Jason, if you want to come back, I have else. Let me see. Okay, Ms. Thomas, if you can unmute yourself, please. Ms. Thomas. Okay, so we're going to move on. I'm hoping that folks are hearing me. So let's move on.
I can hear you, Janet, so.
Okay, let me see. Okay, so let's move on to the next screen.
Mm-hmm.
Right ahead, Teresa.
Yep, we wanted to talk a little bit about the perspective of a child facing homelessness. As I said earlier, there are a lot of different ways that children react. They could be worried, they could be pensive, they could become aggressive, or they become withdrawn. They can become isolated and not want to talk with anyone or their peers about what's happening in their lives. Some children will act out in anger, or they may be distraught. They may be confused. They don't know where they're going. At the end of the day, they may not know where they're going. And that can be a really unstable situation for a child dealing with anything having to do with homelessness or housing instability. I would just ask you to take a few minutes to think at some point later on, how, you would react. Go ahead into the next slide, Natalie. So what we also wanted to do was make the connection between homelessness and trauma. Children exposed to adversity and trauma are at a higher risk of developing negative health and social and economic outcomes throughout their lives. Homelessness is trauma. It is fearful thoughts and worries constantly. Will I have a place to live? Is something bad going to happen to my family? And we here at Crossroads are here to make sure that families do have a place to live and that nothing bad is going to happen. And we're going to do everything we can to get folks back into stable housing. But that connection between homelessness and trauma, there is no doubt that becoming homeless is traumatic.
Yes, if I can add, Teresa, you know, Natalie and I were talking about this earlier, that we know that many times, you know, our families, because they may not have supports from other adults that can help them as they are, you know, looking for the resources that they need to make sure they can prevent from being in the situation. Sometimes our families do not have any choice but to take their children along to the appointments and sharing their struggle that many times, you know, make them feel very emotional, and they obviously cry because it's a hard situation for a family to have to say that they don't have a home for their family.
Yes.
And that is an experience for a child who's sitting there and watching their adult loved one cry and be so vulnerable. And so
Yes.
I think, you know, what I want to share with folks that are on the call right now is that if you do have supports, other supports, and you have to, you know, be out and going to different appointments, please try your best to try to, you know, maximize the opportunity when folks are offering to support you, to leave your children with them while you're trying to resolve the situation, because obviously it's hard. Many times it's hard to either get on a bus with all of your children, but also having to, you know, share the reasons why you're in the situation. So for those of you on the call, if you do have family members or friends that might be in the situation, just know that, you know, you also offering the support will be helpful in limiting or reducing the anxieties and, you know, the trauma experience.
Yeah, sometimes, Janet, we've even experienced families that will come in and mom and or dad do not speak English. And so sometimes they'll use the child as a translator. And that can be very, very difficult. Here at Crossroads, we try to make that, we try to not do that. We have several different languages spoken by employees here, and we have a translation service. We can basically get any language at all within just a couple of minutes. So yes, we want to try and relieve the children's worries,
Right.
and as well as the parents. But yep.
Thank you for sharing that, Teresa, because
Yes.
it's important that our families know, those on the call, you received an invite today to be able to be on this call, you know, receive the Zoom. That means that obviously you have a child that's enrolled in the district or a family member that has you, let's say, as a guardian. So one of the things I want to make sure that you're aware of is that if you have a language barrier and you do need an interpreter, you know, every school has access to a line that they can actually call, a phone number that they can call. And we actually have interpreters available on the spot by just calling this particular phone number. While the interpreter will not be there in person, but it is someone that we have access to by phone. And so pretty much you also don't need an interpreter when you go to any of our offices because we do have access. And so it's a new system. So we are getting better at providing services to our families. And so I just want to make you all aware that if you do go to one of our schools or even our department, a lot of departments have, and a lot of schools have interpreters, but not necessarily an official interpreter, but someone that speaks the language, but not all of our languages. Our district, you know, represents over 49 languages. And so obviously we don't have, you know, staff that will represent all languages. And is the reason why we are obviously have to get the support from, you know, from other outside agencies. So just be aware of that.
Okay, we can move to the next slide, please, Natalie. So we wanted to talk about the impacts of living in a shelter. Children and families who live in shelter need to make significant adjustments to shelter living. Shelter policies typically are instituted for safety purposes. However, they may not support positive parenting and healthy family interactions. Especially now in the time of COVID, right? We are having to keep families away from each other and socially distancing. So we're not able to have the same parenting groups, having dinner together, all of the things that we would like to be doing in order to make those healthy family interactions. There are some shelters in the state, they are privately funded, but they will deny admission to fathers. So they will they will admit moms and children. They may also prohibit pets and personal food. It's very difficult when you have a family come in and maybe they have some more resources and we have one family eating, a lot of snacks and sugary snacks, and we have another family who has absolutely no income. So what we try to do is make it across the board. We will provide food so that everybody is getting the same, and then making sure that there's no contention between families going in. Shelters may resemble barracks rather than a home-like environment. Typically, families who are referred to shelter, there is one room for each family. That room may have 2 or 3 or 4 beds, depending on the size of the family. And we try to, because of a lot of different things, families are living in those rooms. It's hard to clean. We want to make sure that there are no issues with, I don't want to, bed bugs would be sort of thing. There's no carpeting, right? We're keeping the hardwood floors, we're keeping the cement floors, making folks as comfortable as possible, but at the same time, having to worry about those situations that may spread from room to room. One of the things we don't want, and one of the reasons we also don't want to create a home-like environment, is because we do not want anyone living in a shelter for a very long time. Shelters are supposed to be very short stays. We need to focus on getting folks into their apartments so that that is where they can make their home. We don't want people coming in and hanging up pictures and getting really comfortable, because the focus needs to be on getting folks out and back into stable housing. So that's one of the reasons it may resemble barracks, among others. Families in shelters are often isolated from their social networks, family routines, traditions. Families in shelters are not allowed to have visitors. Certainly they can go wherever they want to, but if a family is living far away in a shelter from other family members or other resources, they may not be able to get back. We do have time limits, right? We try to have everyone back into the shelter, especially a family shelter, by 8 o'clock. Certainly there are other instances that will precede that rule, but generally there are curfews, family routines. We may not be able to have a birthday party. We may not be able to provide an environment where people would be experiencing in their own apartments. And so that again is one of the reasons why we focus on getting folks back, not making the shelter as a home like environment, but getting the families into their own apartments. last point here is that children in shelters are more prone to experiencing greater interpersonal difficulties, physical problems, illnesses. As much as we try to keep things clean, it is very closed quarters. And there are the family shelter for Crossroads, the shelter houses 15 families. I know that when my children get colds, it spreads through the family fairly quickly. And so illnesses are a concern, physical problems. We don't have, what was I going to say for physical problems? Just, it's not conducive. Everything is ADA compliant, but it's not comfortable. And that can be really hard for a child. It can be embarrassing for a child. And so when they see somebody, maybe they know somebody, maybe they're scared that somebody's going to see that they're living in a shelter, those interpersonal difficulties can make a huge impact on the life of a child. So at Crossroads, we believe that there is only one true solution to homelessness, and that is housing. We utilize a housing first model for which the most vulnerable families are provided with safe, respectful, and effective housing opportunities. Housing first means that we do not require anyone to complete any sort of income, any medical or any substance abuse issues. We promote housing first, and then if there are any issues that need to be dealt with, we will talk about that once the family is back in stable housing. Studies show it is a best practice. People are much more successful if they are in a stable home environment and are then able to deal with the challenges and issues with which they want to deal with. We believe very highly in client choice. You are not forced to do anything, or anyone coming into one of our shelters. There's no choice. There's no, we don't ask anyone to do anything. There are shelters around the state. So if you were referred to a shelter that happened to be down in Middletown, if it's not good for your family, then you do not have to go. You would wait for the next shelter opening to come. So client choice is definitely a focus. We want to work on what the families need to work on. There are no expectations about what we want you to work on. We can go to the next slide. So how Crossroads can help. The supports and services available at Crossroads include a myriad of different things. Community resources, assessment and diversion. What that means is that the state of Rhode Island has instituted a coordinated entry system. Everyone seeking shelter or housing in the state of Rhode Island and needs to access homeless services needs to contact the coordinated entry system. The families and individuals will go through an assessment and they will be given a score. Due to the scarcity of resources, the highest need clients get the shelters and the housing opportunities first. So we could go back to looking at that category 1, literally homeless, people living in cars, people living outside, people living in locations that are not safe or do not have warmth or water. Basically, that's how the system prioritizes out to all of the available run state shelters and housing opportunities. Diversion is a practice in which we try to help folks get back into stable housing before they have to come into a shelter. If for some reason, you've lost housing, you're living in a car, but you have a job and you can sustain an apartment, we will do everything we can to get you right back into stable housing. There is no reason for anyone, if they can manage, to go into the shelter system. We do have emergency shelters at Crossroads. We run a women's shelter, at 160 Broad Street. We do have a family shelter. We have a domestic violence shelter. We also have an individual men's shelter, and that is down in Cranston. And we do have a 30-bed emergency shelter due to COVID that has been set up, and that is also right here at the 160 Broad Street location. Next, we do have housing navigation teams. So for the clients that come in and are working with Crossroads, we have a team that is strictly out there finding apartments. They are discussing and making relationships with landlords. I know that part of our housing navigation team comes to the courthouse at the eviction courthouse, and they're also making relationships with landlords there. And that team, that is strictly their job, is to find apartments. We have a domestic violence program. So for anyone who is that category 4, who is fleeing or attempting to flee, we do have a domestic violence program that families or individuals can come into and receive the supports to get them back into a safe, stable environment. Crossroads offers case management. So we have 3 different levels of housing. One would be that diversion, where we get you back into stable housing before you even come into shelter. We also have a program called Rapid Rehousing, which is also state funded. That is transitional housing. So you would receive assistance for up to 1 year. Sometimes it can go a little bit longer. That is a subsidized program. So the client would pay 30% of the rent, the state subsidizes the rest, and you work with one of the case managers to get yourself back on your feet, whether it has to do with income, it could do with career, it could be education. GED programs, we also have a certified nursing assistant program. So anything that we can do to support a family or an individual to get back into a stable environment, that's what we're going to help with. The third level of housing that we have is for the highest need folks that are living in the state. That is permanent supportive housing. You do have to be chronically homeless, which means you need to be homeless for at least 1 year, and there has to be a diagnosis or a disability, and you have to have be receiving some sort of SSI or SSDI in order to qualify for that. There are very long waiting lists for each of these programs, which is why we focus so much on the diversion aspect. If there is something we can do to help anyone get back into stable housing as quickly as possible, that's what we're going to do. What's up next, Natalie? So action steps for the coordinated entry system. If you or someone you know is experiencing homelessness, you would want to give them this phone number. It is the coordinated entry hotline. It is run and managed by the Rhode Island Coalition to End Homelessness. The phone number is 401-277-4316. The hotline is available from 9 a.m. until 9 p.m. each weekday. Holidays and weekends, they are open from 2 p.m. until 9 p.m. and messages are accepted 24/7. There is also a web link at rihomeless.org. Crossroads Rhode Island also has a link to that web link where you would just fill out basic information and a housing assessment agent would give you a call back as quickly as possible. That's how, if for some reason someone is experiencing a housing crisis or is actually homeless, you want to get to that hotline as quickly as possible. Next slide. Okay, so that's a lot of information that we've discussed in a very short period of time. I would love to know if anyone has any questions. I'd be more than willing to share any resource or anything that I can help with.
We do have someone that has raised their hand, Teresa, so I'm going to see. It's Lisa. So Lisa, if you can unmute yourself. and ask your question. Go
Yes,
ahead.
hi. So my name's Lisa and I have two questions.
Okay.
One is for the Providence School Department because I did hear something that was brought up in the slide, which is children with homelessness also face trauma. So does the Providence School Department have any resources to help those children while their families are trying to deal with their homelessness, some type of resources for the children during that time of crisis? That was my first question. And then the second question is, I had read on the slide that also shelters may deny admissions to the fathers. And so like with like the families being broken up at that, like, is there any shelters that actually do take the children and their like the family as a whole versus like the father being separated? And then there was said something around like there's 15 houses that Crossroads have for families, like shelters for families. Is that including the fathers, or is that just the mother and the child?
Okay. So Teresa, you can take the second question and I'll take the first question. Okay.
Sure. Yeah.
Thank you so much, Lisa, for your question and for joining this session this evening. So for the first question regarding PPSD supports for students experiencing trauma because of homelessness or even any type of trauma in general. So we have social workers in the district. And one of the things that I'm responsible for as a homeless liaison is to also build awareness throughout the district with other staff members. So like some of the topics that we talked about in terms of experiencing homelessness and what does that look like? What are the signs? That is something that I also have to inform our staff. And so one of the things that I have to do is also provide trainings. This right here is a workshop for our families, but we also present to our staff members. And so we're still trying to get through to everyone in terms of attending a training like this. And so in terms of supports, we have nurses, we have psychologists, we have social workers, but we also work very closely with other outside agencies. So when we connect with our families, when we know that families are facing, you know, this type of struggle or whatever it might be that a family is facing, we're so hopeful that families will come forward to share what is their situation, so that way we can connect them to resources. Because if we don't have the resource internally in the district, then we will connect them to outside resources. And again, Teresa did mention earlier, once a family shares what is their struggle, our next step is not to connect them to DCYF or anything like that. No, we want to make sure that the student is coming to school, but we also want to make sure that we can help the family. But we can't help if we don't know what's happening. So, so to answer your question, we do have supports in our district, but if we don't have a support immediately or for the purpose of that child who's facing trauma, then we do have obviously relationships with other agencies that we can connect the family to. Okay, Teresa?
Yes, absolutely, Lisa. Thank you for allowing me to clarify. So there are 3 state-funded family shelters in the state of Rhode Island. Crossroads operates one of them. There is another up in operated by CCA, Community Care Alliance in Woonsocket. And then there is a third, Lucy's Hearth, which is operated down in Middletown. Each of those state-run, state-funded shelters allows a family to define their family as they see fit. Fathers are 100% allowed in any of those particular shelters. Where you would find the difficulties would be for privately owned and operated shelters that happen to be around the state. So yes, Crossroads families, entire families are allowed in together. We absolutely want to encourage that.
Thank you very much, Lisa. Okay. Any other questions for Teresa now? If not, we're going to move on. Actually, is there a question?
Yeah, there's one in the Q&A.
Okay. So Teresa, there is a question here. Is there a direct number for diversion? And maybe we can, is there a direct number? And if there is, maybe we can put it in the chat.
Yep, I will get that and put that in the chat for sure.
So Mary, Teresa will go ahead and put that phone number in the chat. Okay. Alrighty. Okay. So from now to the end of this particular session, what we're going to talk about now is how does PPSD work closely with Crossroads, but also how do we actually become aware of our families who are facing homelessness or our students facing homelessness. And so one of the things that we want to start off with is just making sure that you all understand that there is also a definition under a particular law, and it's called McKinney-Vento Homeless Assistance Act. And so this, again, it says here, right here on the left-hand side, this law creates a definition of homeless that is more student-centered. So this is very much about thinking of the child. Is the child going to school? What's causing the child not to be able to concentrate in school? And so building awareness is very important. But this is why for us as a school district, we have to be in a place where we can better identify our students who are facing homelessness. Therefore, our families, we will be able to connect them to resources. So on the right-hand side here, you'll see what is this definition of this law. And so I'm going to read it so that way you understand clearly that the term homeless children and youth means individuals who lack a fixed, regular, and adequate nighttime residence, and includes children and youth who are sharing housing due to loss, hardship, and lack of alternative accommodations, abandoned in hospitals or waiting for foster placement. And so in terms of sharing housing due to loss, sharing housing pretty much means if you're doubling up, which is another way of saying this, which is that you are living with another family while you are looking for permanent housing for yourself. And so that could be a friend, that could be a family member, that could be your mom or your dad, but that you have children and therefore you have a family and you should have your own place. And so these are the 3 bullet points that we concentrate on in terms of defining what is this type of situation that this family is facing. And at the bottom, you'll see unaccompanied homeless youth are young people who are experiencing homelessness who are not in the physical custody of a parent or guardian. And youth that fall under this category are youth who are either, who have either run away, are sleeping, outside somewhere, no one knows, separated from a family or for various reasons, was kicked out of their home again, or are abandoned due to pregnancy, other social factors that really a lot of families are facing at this point in terms of family conflicts, mental health or alcohol and other drug abuse, other reasons why there's, why this youth for some reason is not at home or is staying with friends. So that would, be the definition of an accompanied homeless youth. And for the most part, we see these students being those in either middle school or high school. I did want to, and I thought it'd be important to kind of share in the past few years, what it has looked like for us as a district in terms of identifying families that might be, facing homelessness. So you'll see here that we've broken it down into elementary, middle, and high. And so for the past few years, you'll see here again on the right-hand side specifically, that in 2019, that particular school year, we identified about 259 families. Into 2021, which was last year, we also identified 131. And so again, but wanting to give you exactly where we are today. And so at the earlier of the month in November, we were at about 167 students identified. So this just shows that there is an increase. We know that we had a pandemic. So there are a lot of reasons why families are in this situation, and we'll talk more about that. But here you'll also see that nationally, and this was a report that was done back in January of 2020 by the National Center for Homeless Education. And this report shows the information below in terms of enrolled students experiencing homelessness in Rhode Island. And these were the numbers in total that were identified. But we all know that these numbers tend to be low just because we know that there are other families that just don't know that they are considered homeless if they are sharing housing with someone else due to hardship. So that makes it a difference. It's either you choose to live with another family because we know that right now affordable housing, there's not sufficient affordable housing right now, or that the rents are really high, families can't afford. Unemployment is really high. And so again, these are some numbers that we also know are not always accurate because families don't come forward or haven't been identified. Here in terms of the root causes. So as we work with families, we are also identifying, okay, so what's causing our families to be in this situation? And I just mentioned a few. The pandemic is always number one for different reasons under the pandemic, not only because families have gotten sick, have not been able to go back to work, but clearly these are the top 5 reasons that we have identified, which is eviction, the high cost of rent, your loss of job, fire, or even domestic violence. So right now, this is what we can tell you. I'm sure that there are other reasons that you might be aware of someone else being in the situation. We clearly want to be in a place that we can support all our families as soon as we become aware of their situation. But you'll see also on the right-hand side, what then from root causes, what are the identified needs? So once we, work with the family, we right away need to find out what is it all that you need to be in a place where you are safe, and that you obviously are moving forward, making sure that your children are attending school and whatever else can help you in the meantime. So transportation, as Teresa mentioned earlier, is definitely one of the barriers for many of our families. So that is one of the needs that we normally tackle right away. And it always tends to be kind of like the easiest that we can handle because we have a transportation office, we have collaborations with the statewide transportation. So if you live outside of Providence, but your child is enrolled in the district of Providence, but you are actually sleeping outside of the district, then we are able to arrange transportation. And so with that particular city and also with our district, and we just arrange it. So, and then we let you know. So that again is something that is pretty simple. Now, what I do want to make sure that you understand that while you might be in this status where you are in a temporary situation, not all the time does that mean that you will be able to get transportation like a yellow bus or even a ripped up bus pass. And so it's going to really depend. So for instance, right off Broad Street, we know that that there's a shelter right off Broad Street and is just up the street from one of our elementary schools. And so clearly, because it's only up the street, a bus will not be assigned to that particular student because again, it's walking distance. And so that's just one basic example. But these other identified needs, again, all based on our conversations with families, like a ripped bus pass that maybe a student did not know that they can actually ask our office and inform someone at the school who will then reach out to us. Again, housing, they do not have adequate housing because they are living with another family because they were either evicted or the landlord did not want to renew their lease. And then again, the list goes on here. So again, these are not because we made these up, but these are needs that families have come forward, including like when we talk about transportation, you can own your own car, but your car might be parked somewhere because right now you don't have the money to repair the car, right? So these are, again, there's more to behind these words until we actually sit with our families. And here again, this is just another resource, which is Schoolhouse Connection. It's actually a national organization. Many school districts reach out to this particular website of the Schoolhouse Connection. And the executive director actually had submitted a report, and basically I wanted to just share this quote where it really highlights the role of schools. Right. And so how schools exist in all communities. And why is that important? It's important because we also want our community to understand and our families that while you might be in a unstable situation, what could be stable for your child to reduce the anxieties, the trauma that they could be experiencing outside of school, that school could be somewhere that could be, again, a little bit more stable. They're seeing their friends, they're participating in programs, in activities, and just learning in general, just to be distracted by what might be happening at home. Okay, which is something that's really out of their control, but know how important it is if they went to school every single day. That allows our adults in their lives, right, to be able to look for the resolutions that they need while their child is getting their education. And so as a homeless liaison, you should know that in every single district, in every state, because it's a federal law, a homeless liaison has to be assigned. And so I'm that person for the district. Natalie supports my efforts here at the FACE office, at the Family Engagement Office. And so here is just a list of some of the responsibilities that we have to make sure is happening in the district, right? And so increasing awareness and identification, we're doing this by sharing this information here and hoping that if any of these slides, you know, are important to you, that you are taking pictures of it, so then that way you can go ahead and share it with someone else, because that is, again, helping us build this awareness. I mentioned earlier that we are also providing training for other teachers and staff in the district so that we can be an army of people understanding the rights of our families that are facing, you know, housing insecurity, but also so that we can connect them to resources. Again, making sure that our families, once we know that they are not in a stable situation, but they need to enroll them in our district, that we right away enroll them, regardless of the required documents that we eventually have to gather. But we want to make sure that that doesn't become another barrier where the child is not going to school. Providing parent involvement opportunities, so all the activities that are happening in the meetings, that are happening in the buildings, in the school buildings, that again, we are opening those up to all of our families, including our families facing homelessness. And then informing and providing transportation services, as I mentioned earlier. And then other duties include like posting notices. And in our buildings, there are some posters that are supposed to be in a visible location so that you are aware that the homeless liaison does exist in this district and the phone number would be available. And that is something that I will share at the end of this session. So again, we have two groups of folks that we are you know, just trying to make sure that we can concentrate on. So we have our children and youth, but we also have our unaccompanied youth, which are our older students at the high school level. And so we know at the high school level, you know, most of the time they do have ripped up bus passes, but we know many times they really don't know where they're going the next day. And so there are agencies out there that are supporting our youth. And so these three different areas here, these categories are very important to us. This is what we try to concentrate on the most, which is immediate enrollment. So we know that we have required documents that before you start school or are assigned to a school, there are specific documents that are required. Okay, so we know they're required, but we also know that staff have been informed that we have to immediately enroll any family that's coming in and tells us that they are in this temporary situation. Example, they come in sometimes with a letter from the shelter, just letting the, giving them that particular form that will demonstrate to the registration staff that they are in a temporary situation. That's an example. Transportation, again, if once we are aware that you are now living somewhere else, not at your current address, we arrange transportation for you, or we provide the RIPTA bus pass for that student. And then finally, if you're in our district, it doesn't matter if you are homeless, you are to receive the same opportunities, the same programs or access to programs and opportunities as any other student. I mentioned the same here in terms of enrollment in the Student Registration Center. But also here, again, we are able to provide yellow busing and also RIPTA bus pass. But we also work very hard to make sure that if you are living outside of Providence, that we will make those arrangements for you. So it's not at the school level, it's actually with myself and with Natalie, but you have to inform someone at the school unless you have our phone number and you can just call us directly. And again, we'll provide you all the contact information. So here again, you know, lack of stable housing, inability to take care of basic needs. Again, these are the concerns and that we again are addressing with all of our families. So how do I help? How can you as a person who's on this call, either you're facing this situation right now, or you have someone else that you know might be homeless. So we concentrate on making sure that we're preventing this from happening. So we're letting folks know that there is a law, that we know that there are agencies out there that are supportive, but then also how do we intervene? And we'll go into that in a few minutes. This right here is a diagram.
Janet,
I don't want to, yeah, go
can I
ahead.
interrupt you just quickly? So we have had a question about the translation. Pedro, they cannot hear you.
Oh, I'm sorry, maybe be too far
Mic
from
or
me.
Pedro's mic
Okay.
is not working. What was that, Janet?
His microphone was not working?
Yeah, no, they can't hear him. Let me just go into the channel real quick. 1 second.
Okay.
Louis, can you talk so that way I can see? Okay. Yes, I can hear Louis, but I'm not sure if I can hear Pedro. No, Pedro cannot hear you. So I can only hear Louis. Okay, thank you. All right, Jenna, we should be all set.
We're all set. Okay, great. So we do have 2 questions so far. I can take those questions right now before I go through these other action steps. The questions are written in Spanish, so I will read them out loud in Spanish and then try to translate. So, okay, so hola, una pregunta. Conozco a una chica que es madre soltera y no puede rentar un apartamento porque están muy alto el precio. ¿En qué manera se pudiera ayudar? So the question is, I have a single parent, and she is unable to rent at this time because the prices are so high. How can we help? Teresa, would you be able to help with that one, with that question?
Yeah, it's a great question. And there are a lot of folks facing just this exact scenario. I would encourage her to give the diversion team a call. If for some reason she's lost income due to COVID, we may be able to assist with a rent relief application. We may be able to find an apartment that is further away from where she is right now. Sometimes being out in the areas such as Woonsocket or down in other areas may be cheaper. Sometimes that works for folks and sometimes it doesn't, especially if you don't have a vehicle. And then I would absolutely probably encourage her to find someone to live with. I don't know if there is a family member or a friend that, cohabitating and jumping in, even if it's just temporary, would be a good way to get her off the street. If she is currently on the street, I would absolutely have her contact that coordinated entry line. And if she is in need of shelter, let's get her on the way to receiving that.
Thank you, Teresa. So we have another question here. Okay, so this person says that I know that there are folks without housing. I live in an apartment of only 1 bedroom. And I've had an application for housing since 2018, but still no housing. I am now 61 and I am not working. I have a dislocated disc in his back. And it's very difficult for me to pay for rent. Where could I get help?
Probably one of the first things I would do, I know that you said that you were on the list for housing, but each and every town in the state of Rhode Island has their own public housing. I would make sure that you can find the list. I don't know how, if this person is particularly skillful with the internet, but certainly Googling public housing, it will give you an absolute 100% comprehensive list of all of the locations, depending on whether you are disabled, whether you are elderly, whether you are homeless, right? There are different prioritizations. So getting as many of those applications in would be probably my first place to go for that. Again, I would I did put the housing problem solving and the diversion team's phone number in there. One of the case managers can work with you to provide resources. CAP agencies, the community action programs in and around the state, they are a wealth of knowledge and they have localized assistance. I would probably get in touch with one of those CAP agencies or your local CAP agency to see what other resources you're available for you. If you are on a fixed income, you may be able to may qualify for LIHEAP, right? Heating assistance, electricity, utilities. Just off the top of my head, those are challenges and struggles that we are seeing with a lot of folks who are on fixed incomes, and it's a challenge. Again, I would say, is there someone else you can live with? Do you have a friend who is also on a fixed income? We have to be creative here. There is no right or wrong answer. What works for one person may not work for another, but we have to look at all of the creative options that are out there. Please go ahead and give the diversion team a call.
Remember, the phone number is actually on the chat. So make sure that you get that phone number on the chat. Okay, so here, just going back to what we have in front of us here at the screen, if you can just look at the very top. Again, these are just the action steps that we've created, where you will understand what happens once you provide us with the information of a family that might be facing homelessness. So the first thing, again, as a homeless liaison, we have to make sure that we are helping to prevent, right? And so what information do you need to have? Well, it's building the awareness, the enrollment, transportation, equal access, transportation, again, that we can support that effort. And again, knowing that the Family and Community Engagement Office is here to support you, that we are partnering with great agencies like Crossroads to be able to connect you to resources. So we don't have all the answers, and we also don't have all of the services that all our families need. So we need the help of the community in the city of Providence and the state of Rhode Island. So from prevention, then we move to step 2, which is identifying our students. As soon as we are aware, which many times the only way that we become aware is if either Crossroads is informing us or social workers are informing us, someone from the school staff or families themselves are coming forward and letting us know of what's happening with their family. Then at that point, we can move forward in making sure that we can connect them to a resource. And right away, at least try to resolve as much as we can with the school department, but if not, we connect them to other resources. In a few minutes, I'm going to have Natalie go and actually show you how we are referring families. And if you are a person that's supporting other families out in the community and you hear of someone that has a child enrolled in our district, how do you help us help them? And so by providing us some information. So in our office, we also have, different brochures and information that we are able to share with our families, with our schools, who then go ahead and share with other families. We also have, again, myself as the homeless liaison, and my staff here also understands that we have access to certain resources. So when you do call our office, it's not that you're always calling Janet Pichardo or Natalie Perez, but that we are your first, point of contact, but that anyone that's in this office is able to, sit with you and actually listen to what's happening with your situation, and then be able to connect you to a resource. And then finally, making sure that as a district, we have, certain things in place to make this easy. Make what easy? Well, to know that there is a family that needs help, well, making us aware that they need help. And so we've created a tab in our website that will, that person that has the family in front of them or knows of a family is able to enter information that will help us connect with them and get more information for them. So again, this screen here, I'm going to have, I'm going to shut, close this and just actually have Natalie open up our website so that you can see. So if you went to our website, what does this look like? What would you have to do if someone just told you that they are facing homelessness? Right? So Natalie, if you can go to the website.
All right, can you see my screen? Okay, perfect. So first and foremost, the first thing that you're going to do is go to our Providence Schools website, which it's providenceschools.org. And this is the main home screen that you will see. Up on the top, if you follow the mouse, these are different tabs. So you're going to go where it says families and community and hit the tab that says community engagement. Now this will take you to the community engagement page, but if you look on the left side, it has other tabs as well. And then that's where you will find homeless and McKinney-Vento. And then you're going to want to click on that tab. And then finally, it'll bring you to our McKinney-Vento page where, one second, where it has, sorry, 1 second. For whatever reason. No. Okay, so this is where it has all the information regarding McKinney-Vento. If you are a Spanish speaker, then you can go ahead and click this link where it says Para Español, haga clic. It'll turn the entire page and translate it into Spanish. Here it goes over the McKinney-Vento and how we help support students facing homelessness. And if you look to the right side, you'll see our list of resources. So here, you'll see social services, housing, food pantries, clothing, health, and homeless advocacy. So all of these resources are available to all families, not just families facing homelessness. If you find yourself, that's why we say housing insecure. So if you find yourself where you do need resources for food or clothes, you can always come here and reach out to these agencies. And then right here is where you will find our referral form. So if you click on that referral form, it'll bring you to the form. And then this is where you will go ahead and fill out the information of the family, whether you are, this is what our school staff uses, but you are more than welcome to use it if you identify a family yourself or somebody who is in need. So we did get a question earlier asking how they would be able to refer a family member, and this is where you're going to go. You'll enter your email just in case we need to contact you for any reason. And then you would go ahead and fill out the form. It's very quick, and just try to fill it out to the best of your ability. The most important thing is that we get the names of the students. Don't worry about if you don't have a student ID. And then the parent name and the phone number, so that way we can contact them and get them that help right away. So if there's any questions at all about having to reach out on how to do this, then you can always reach out to us and we can do it for you. Just in case you're not tech savvy, the most important thing is that if you do identify a family, you let us know so we can get to them right away. So Janet, if you want to go ahead and share your screen again.
Okay. Thank you, Natalie. So we're trying to get to a place where we're making things a lot easier for folks to connect with us. And so if we have a public facing tool like the website, then this is the place to actually, provide us the information that we need to move forward. So we're close to the end of our session here, and I just wanted to highlight the fact that we have a strong partnership right now with Crossroads, supporting our efforts to provide supports to our families directly. And so you can see it here, we're partnering and making sure that we are sharing information to our families. Again, with the resources that are in place, we have a lot of resources in the district. Unfortunately, we wish we had a lot of housing for everyone, but it's hard. So we just want to make sure that at least we are being supportive in the ways that we can. And so on the right-hand side, you'll see also Unite Us. And this is actually a new partnership that we have. We have become a network partner with Unite Us. And so it's a new support here in the state, where, again, they also have a coordinated care network of health and social care providers. And so it's actually a system that, once we become aware of a family, then we ask you the question, are you comfortable with us sharing your information or your name, your contact information, to be able to connect you with other resources in the district? So there's Crossroads, but there's also Unite Us. And so we're just trying to make sure that we're maximizing all the different ways in which we can connect a family facing a particular situation with an agency that can support them. Okay, so that's also, I just wanted to make everyone aware also that we have that resource. And then here, other resources here, of course, you can always call 211, Amos House. Again, we mentioned earlier, CAP, Community Action Partnership of Rhode Island, all these other agencies that are here. Again, we have relationship with everyone, but I think it's important too, if you have your phone now, that you can go ahead and take a picture of this or a snapshot and just pretty much refer to it when you need to. And then this is our contact information. Mine is at the very top, and also Natalie, you can take a picture, and also Teresa's on the right-hand side. And again, we're here to help you in any way. We're really happy that a lot of you stayed on this call, and that we're hopeful also that you are able to move forward with sharing any of this information with other families. And again, if you don't have a question now, but you're thinking that maybe later in the future you will, please take this, take a picture of the screen, save it, because you might need it at some point, or someone else. Okay, I'm seeing that we don't have any questions right now. It's close to 7:30, so I'm going to ask Teresa. Teresa, I'm going to stop sharing here. And I'm going to ask if you have any last words, comments that you would like to share with families before you exit our session.
Yeah, I think just the most important piece is, if you have any questions, please reach out. We like to share information and resources, and we like to stop people from actually becoming homeless. So we would like to help in any way, shape, or form. Do not hesitate. I know it can be a scary situation. And for the most part, folks don't call us until it's too late, but there are avenues for us to prevent homelessness, and we would love to be able to help out.
Okay, well, Teresa, thank you so much for joining us this evening.
You're very welcome. Thank you for having me.
You're
Have a
very
good
welcome.
night, everyone.
Thank you very
Take
much.
care.
Take care. Bye-bye. Okay, so we want to make sure that everyone that's on the call, please do not.
Janet.
Yep.
We actually had a question, a raised hand. It's by Alice Hector. 1 second. So Alice, if you can unmute yourself.
Sorry, I'm not too familiar with this. But can you hear me?
Yes, we can.
Okay, sorry. The numbers, I was trying to take a picture of the numbers and the email addresses, because I know quite a few people, some are family members and friends that are in a situation right now that are homeless. One is at a hotel, and the other one was a victim of domestic violence. And so I just was trying to gather as much, as many names and numbers and resources that I could possibly get for them.
Okay.
I myself am in the middle of a situation, trying to port out of Providence to a different town, and I'm having some issues as well. So it'd be nice to maybe, I don't know if this is gonna be recorded so I can go back to it, or if someone can send me an email with some contact information, would be nice.
Sure. So Alice, so we just had a screen up with our phone number. Did you grab that?
You know what, I kept trying to downsize the picture to take a picture of it or something, and my screen kept blowing up to the chat, to the
Okay,
screen, and it,
so no problem. So we're going to give you a phone number that you can call, which is our office. And if you have someone that is in a situation right now that needs support in terms of homelessness or being at risk of it,
yeah,
you're welcome to, calling the number that I'm going to put in the chat right now. And this is for everyone. This is the Family Engagement Office. And so just, if you can call that number, if you get a voicemail, please make sure that you go ahead and leave your name, your phone number, and briefly just say that you are looking for information for yourself because you're in a temporary situation or, risk of being homeless. That brief message will reach here in our office and we'll be able to connect you right away.
okay. And where would I find the chat? Where's the chat? Oh, is that it at the bottom?
Yep, you see the very bottom? Yep, where it says chat. I just put the number, it's 401-456-0686.
401-456.
0686.
06. Sorry, I don't have my glasses on.
It's okay.
Now, do I address somebody in the message? Like, is it somebody I can
Yeah,
particularly?
you can say, sure. You can say either Natalie or Janet. So both.
Okay, all right, thank you so much.
Okay, you're welcome.
Also,
Okay.
Alice, our staff members can also fill out the referral form on your behalf. So if you feel comfortable sharing that information with them, they should be able to do that. So that way it can speed up the process and we have all that information once we do reach out to you directly or the people who you intend to refer to us.
Okay, and so just let them know that I'm gonna refer them? Is that what
So
you said?
yeah, so you can refer them if you have all their information, or you can give
Oh, okay.
the number to our office as well, and they can give us a call.
Okay, all right, sounds like a plan. Thank you so much.
You're welcome. Thank you so much. Don't leave, okay? So you can try to see if you can get one of these giveaways, okay?
Okay, all right, thanks.
Thank you. Bye. Okay. So let me share my screen.
I don't want to mute this.
Can you see my screen, Natalie? Natalie? Can
Yes,
you can?
Mhm.
Oh no, what am I doing?
I believe I have.
Okay, so what I wanted to just share what other that we're going to raffle off. So item number 1 is the 5-pack Roger Williams Park Zoo admission tickets. Then we'll raffle off the nice slice $25 gift card. And then we will raffle off this beautiful ceramic vase that's right here. There's a picture of it on your screen. It's a value of $31. It's from Cardi's Furniture. So it's a beautiful vase. So these are the 3 items that we are raffling off this evening. I am going to leave this up. And what I'm going to do is I'm going to time. I don't know, Natalie, if you were able to put the form.
Yep, it's already in there.
Okay, so if everyone can look at your chat right now, there is a link that's in the chat. And if you can just press that link, and as soon as you press the link, questions are going to come up. So it's actually a survey or a feedback form that we would like for you to complete right now for the next few minutes before we close and before we do this, the raffle. Now the raffle will, if you complete the form, you will be entered into the raffle. So we're hoping that everyone on the call right now is able to go ahead and complete this form. So that way, once Natalie is done, she's going to actually show a wheel that will appear on the screen with everyone who completed the survey. So just make sure that when you complete the questionnaire or the survey, that you don't forget to press submit, so that way we can record your name, and then your name will appear on the screen as soon as the 5 minutes are up. So I am going to time ourselves, and I'm going to put it loud here. And in the meantime, while I'm taking this timer, yeah, so I did want to remind everyone, that the FACE office, again, that's the Family Community Engagement Office, the office that I oversee. Natalie is part of our team here. And, our office is available to assist all our families, new families that have arrived to the district that have recently been enrolled, or any family that has any children between kindergarten and 12th grade. We are here to help you in any way. So if you have any questions, any concerns, if you're interested in understanding, what are the different meetings that are offered in the district, like school board meetings, how do I have access to when these are happening? This type of general information is what we are able to answer. If there is a situation that's happening at the school level, your child has come home complaining about something at the school level, and you have addressed it already with the principal or with the school teacher, and you feel, you're not satisfied of what's happening, you're not being listened to, or it's not being addressed. We are the other source that you can reach us and find out if whether or not we can also help facilitate and again, assist you in any way that we can. We mentioned, again, this session is all about our support in terms of whether or not your families are in a situation where they are living in a temporary situation. So we want to make sure that you know that this is the office that you can connect with. However, your social workers at the school are also aware of our office. Also, the school staff are aware of our office. So we just want to make sure that you know that if you are in a situation that you need help and connected to a resource, please let someone know. But you also have us as a resource. So today the session was on homelessness, but now for the month of December, we have a few others. We have, trauma and what does it mean and who can help my family? So that's one that's specifically on trauma. So those of you who might be on this call that would like to learn more about, what the district is doing to support our families that might meet or students that might be facing trauma, then we will have, staff from our social work department that will be able to share more information. So please try to attend that session. That will be on December 9th. So again, that's already next week. So, and then on December 14th, support your child's emotional development. So we'll have someone also from the Providence School Department and a partnership with Brown University who will also be presenting for that particular session. Again, that's December 14th. So our purpose with the Parent University is to make sure that we are providing information to our families, building your skills and knowledge. In the future, pretty much in the spring, we will be offering some courses where we have a collaboration with CCRI. So they will be certification courses. And so we want you to keep an eye on the different invites that we will be sending your way. It will be either through the Kimbo messaging system, which is the texting messages that you've been receiving. So make sure that you pay attention to all the messages that you're getting, including invitations and flyers that are coming from your schools. Try not to miss any opportunity. We are always trying to make sure that we are providing information as early as possible. So that way families can make plans to attend, especially, for instance, our Zooms. We are always trying to make sure that even if we tell you about this Zoom 2 days ago, we're going to tell you the Zoom is happening the same evening, at least 45 minutes. Okay, so I think that was my timer for just making sure that folks are completing the form. Natalie, do we have a good number of folks who completed the form? We have.
1 second, I'm just adding the last few names.
No problem. So we had a comment. Thank you for sharing. I'm so glad someone clarified all the texts I've been getting from the school, just moving from a different district. Yes, So let me share that, districts are responsible for making sure that we can get better at communicating with families, right? So in the past or years ago, it was always a flyer or a hard copy piece of paper, sending it in the backpack with the students. Well, that's still a way of communicating with our families, but that's not the only way anymore. So we're sending you a text, which has been best tool that we've had right now that's helping us make sure that we get information to our families is through text. Since so many of our families do not have landlines anymore at home, they are basically always with their cell phones. And so the messages that you're receiving either through a voicemail message or texting, and we're sending reminders, is because we know families have also told us, we appreciate the reminders. And so that's all we're trying to do, is just making sure that you don't forget, because you might have, you were probably interested in attending, and, had we not sent the reminder, you would have forgotten. So we also have another way of promoting, or communicating with our families is through the Skyward Parent Portal. So there we also post the flyer of these sessions. So that's just another way, as long as our families have access to that parent portal. And if you do not, because for some reason someone, at the school level has not provided that login information for you, then please, we'll be happy to help you out with that as well. So here we go. If you see in the screen, we have a wheel. And so the first prize that we will be raffling off is the free admission Roger Williams Park Zoo tickets. And so these are all the names of folks that completed the feedback form. So as soon as it stops, it will announce the winner. Okay, so our winner is Julio Gonzalez. So Julio, please make sure all of our winners for tonight, make sure that you see the chat. We're going to add the 379 Washington Street address. That is where we are located. We need for you to actually come and claim these prizes within a week. Okay, so it's really important that you come within a week to claim these prizes. So again, look at your chat and you will see that our address is 379 Washington Street. And you can come here and just say, hi, I attended the session the other night and I'm here. My name is Julio in this case, and you can claim the prize, which again is 5 free admission tickets to Roger Williams Park Zoo. The next prize is the gift card from Nice Slice, which is a pizza restaurant, restaurant right near our office, and it's for Alice Hector. Alice Hector is our winner. Congratulations, Alice. Make sure that you look at the address, write that address down, come by. Our hours are from 8:30 to 4:30, so please try to visit our office between that time. Holidays are coming, so please come within the next week, so that way you can claim your prize. Okay, and then the prize is actually the vase that I demonstrated earlier. So it's the next winner. Is this the winner already, Natalie?
No.
Okay. Oof, I was gonna say, wait, I didn't see a turn. So our final prize is the vase, ceramic vase, and that will go to the winner, Reina Perez. Okay, so again, a reminder, come to 37 Washington Street between the hours of 8:30 and 4:30. Congratulations to all our winners. And thank you so much for attending our session this evening. Don't forget, we have 2 others next week. Be on the lookout for the text that you'll receive as a reminder. Thank you again so much for attending. And thank you again to our interpreters for assisting us this evening. Good night, everyone.